My name is Bobby Kane. I'm very excited to be here today with a man I respect very highly and have been fortunate enough to work alongside with for about 2 years now. Dr. Dan Hoffman, a somatic psychologist currently practicing as a psychological assistant at Iris Healing Retreat under the supervision of Dr. Helene O. Mahoney. His particular areas of interest include sexual abuse and trauma healing, developmental trauma healing, and working with anxiety, depression, and substance abuse. Dr. Dan has written dissertations dealing with sexual trauma from a somatic perspective, experiences of people who had received somatic trauma treatment after sexual abuse and assault. His master's thesis was published in the USABP journal dealing with understanding connection between attachment-based and somatic perspectives on the development of characteristic emotional regulatory patterns. His educational history, he's got a BA Psych from University of Michigan, MA in Clinical Somatic Psychology from Santa Barbara Graduate Institute, and a PhD in Clinical Somatic Psychology from the Chicago School of Professional Psychology in Los Angeles. He regularly attends ongoing psychological training, such as Relational Somatic Psychology, Threefold Way, and Brainspotting. So without further ado, Dr. Dan, welcome to the show.
Good to be here, Bobby.
I'm so glad to be here with you.
Yeah.
So, as I mentioned earlier, I've been fortunate enough to work alongside with you for a little over 2 years now. And I'm curious, was there anything in particular that drew you specifically to the field of substance abuse treatment?
Yeah, it was a little bit of a stroke of luck that I made my way into substance abuse treatment because one of my very good friends at my master's program was working at a facility with addiction and recovery.
Mm-hmm.
But as I've gotten deeper into the field, it is a field that's really tremendously impacted by trauma. You know, in any kind of addiction and recovery process, generally at some level, there's a trauma that's happened. Either it's early in someone's life or it's come along a little bit later. And not only what we usually think of as traumas, like the big, what they call big T traumas, like a car accident or a sexual assault, but also what is referred to as little t traumas or developmental or complex traumas, which are sort of the accumulated difficulties in attachment relationships, childhood neglect, abuse of a less than extreme, magnitude, things like that. And in a lot of recovery processes, dealing with that trauma really helps people to get a little bit of a leg up. Because trauma has a pretty tremendous impact on how people engage with their lives. It can make people more sensitive to things that those of us who haven't been through as much trauma are the same kinds. So in just about every client that we see at our facility, there's some form of a distortion in the way that they regulate emotion. Instead of using either relational emotional regulatory skills or internal emotional regulatory skills, they're using an outside substance to help manage their internal experience. And those distortions in emotional regulation are often caused by those various kinds of trauma, both the extreme post-accident or, a mugging or something of that nature, or natural disasters can also have, especially now living in California, we're seeing a lot of the impact of that on people. But also, again, those developmental or complex traumas are changing the way people process emotion. A lot of times, what makes something traumatic in a lingering way is that whatever happened at the time wasn't given the space to kind of be a little bit vague, whatever the impact, the energy that the person took in around the trauma. And I don't mean in sort of a out there kind of version of energy, but whatever their nervous system took in around what happened. If it hasn't been untangled, dealt with, or healed, then it can be very hard for a person to return to like a baseline homeostasis state. And so that's where the substances come in, is that they can be that external something to help, change the emotional state. So that's what's kind of what brought me to addiction was luck, but what's kept me here is that I can do the work with people to heal from those both early life and, later traumas that have impacted their addiction and recovery process.
Wow. Well, that's a great answer, and I'm so glad that luck had brought you into this field. There's certainly a need for more people like you that have such drive and passion and education around what you specialize in. So I heard you mention that the majority of the clientele that you serve do have some history of trauma. Some may come in and be completely unaware that they have had these traumas, because when mentioned in, the general public, I suppose, you'd think of the more significant issues, some type of abuse or accident or tragedy, really, loss, whatever it may be.
Mm-hmm.
Can you maybe get into why it is so important to address the underlying traumatic issues that people may have throughout the course of substance abuse treatment?
Absolutely. What tends to happen is that people with the best intentions and a really good understanding of sort of the practical steps that recovery takes often run into, triggers is the word that most people use around it, but something gets underneath that really great plan about how recovery is going to go. And generally, whatever that something is that gets underneath the really good plan about how it's going to work out has something to do with the person's past, something that they went through growing up, or some way that they're still not able to really regulate their experience of those things without defaulting to their old habits or patterns. So I know a lot of people think that dealing with trauma is kind of like a magic bullet, that if you just do that, recovery is going to follow, just one step after the other.
Sure.
But I much more believe that it's not necessarily the solution, but that without it, without dealing with the trauma, without dealing with those impacts of the past that a person's still living with, it can be a much more difficult path. And for some people, it's really essential because it is that past impact, that past trauma that they keep stumbling over again and again. And it can lead to a lot of frustration and hopelessness of, I know all the steps to take, I know what I need to do, but why can't I do it? And a lot of times that's because there's something else that's there that they haven't really taken a look at yet.
Yeah, it makes complete sense to me. I've seen it over and over again. And I think the probability of somebody relapsing, if the traumatic issues haven't been dealt with, are much, much greater. And, because there's that constant emotional pain until it is dealt with and healed and addressed. There's always going to be that desire to escape. So I'm a huge proponent of including that in treatment. So I guess to back up a little bit, what developed your interest in studying somatic psychologies?
When I was younger, I actually was a little bit torn between studying engineering and psychology. And I had a talent for math and science, so it was kind of assumed that that was what I was going to do, going into school and everything like that. Going into college, that's what I went for, was engineering. But, at that time I wasn't really happy with it. I felt like I was doing it for somebody else. And it was around that same time that I got involved with a group of martial arts practitioners in Michigan that studies a martial art called Wu Chi Fa, and the school's called the School of Cultivation and Practice. Mm-hmm. So I got involved with this martial arts group, and it's not a martial art where there's a lot of complicated forms or exercises that are really, elaborate. It's really fairly simple and predominantly is based on building your awareness of how your body is doing really simple things like standing or walking, and doing those things in a way that's connected and integrated so that the power of the whole body can work together in expressing your intent, whether it be martial or otherwise. And in that school, the senior school brother, the guy that was helping us all learn and develop, was not only a martial arts enthusiast, but also a really big proponent and student of one of the sort of preeminent figures in somatic psychology, a person named Wilhelm Reich. And in addition to doing the martial arts exercises, he gave me some of these books to work with. There are certain exercises that come out of that, a lot of different breathing, awareness things, both from that more Reichian kind of somatic psychology, as well as the forms that came after that, physical exercises and things to get in touch with the emotion.
Sure.
And it was fascinating because as I did these really simple martial arts and other exercises, a lot of feelings came up that I had not really been in touch with before that. I was very, very, more creative, intellectual type and not very embodied.
Sure.
And as I did these exercises, I started realizing the ways that I felt about all these things that I was doing in my life, including following this expected pattern, which was to become an engineer, or what I thought was the expected pattern. And as I was feeling all of these things coming up as I was doing these standing practices, for example, I got really curious about, that's amazing. I wasn't doing anything. I was just standing and breathing, and all of these different emotions were coming up. And they actually changed the way that I would interact with my life, because I was realizing some of the things that I was doing that actually weren't okay with me, realizing some of the ways I held myself back from interacting with other people just because I couldn't hide from myself when I was standing there and I would see those things. And went from being a fairly unhappy person, not really enjoying the whole being around and being alive thing, to being somebody that I really enjoyed going through my day and being a part of the world. And I started to think, this is something that's worth doing. If I can help other people get this connection with themselves, whether it's through the martial arts or through psychology, then maybe I can help ease other people's pain and help them live lives that are more free and satisfying. And I went through this whole period of, okay, well, is this what do I want to do? And psychology was the thing that I thought in my mind, well, if I could do anything, this seems like it's really worthwhile to help ease, people's suffering, help the world be a little bit of a better place, help people to hurt less. And then hopefully from there, they hurt other people less. And it just becomes a nice
that ripple effect.
Exactly. So that's how I got into psychology.
That's really beautiful. And I think that probably contributes to the high degree of passion you have for continued exploration of the potentials of these types of therapies. And it's really cool. It seems throughout your explanation that there's a lot of parallels between the martial art that you were practicing and the somatic psychologies, kind of the mindfulness component, the mind-body connection.
Yeah, they were really good parallel to each other. And each one that I did supported the other one. The more that I stood with myself and felt what was there, the more I understood how my body, and then, by extension, other people's potentially could carry different experiences. And then the more I learned about it from the psychology side, the more in-depth I could go with my personal standing practice.
That's amazing.
Yeah.
So what is somatic psychology exactly?
So somatic psychology is a psychology that integrates both the mind and the body into how things like therapy and understanding human experience are approached. So somatic really just means the lived experience of the body. So that can include everything from how our bodies hold emotions, as I was talking about before, to how, our nervous system regulates the experience of us moving through the day. There's a lot of different branches of somatic psychology. Initially, it kind of came out of some of the students of Freud. I mentioned Wilhelm Reich before and other people that worked with him that saw how patterns of tension that occurred in people's bodies corresponded to their ways of being in the world. Talked about how restrictions in the musculature develop out of early life experiences and then impact our later ability to be expressive and authentically ourselves. I can say a little bit more about that later, but I'll talk about some of the other branches of somatic psychology. Other things that somatic psychology does are like dance and movement therapies that allow a nonverbal expression of whatever's going on internally, to things like EMDR and Brainspotting, which approach the way that our brains subcortically hold information and can process that, facilitated by eye position and eye movement. So all of those different forms and others that I haven't really mentioned are really just looking at how we can approach healing from, that organismic, that whole person perspective, and looking at the impact of things like trauma, not only on the way we think, but on the way we're actually showing up in our bodies in the world moment to moment. That's one thing that I think is really crucial about somatic psychology is it goes beyond the stories we have about what happened to us, because everybody's got their narrative, their story about what they've been through. And that can be more or less helpful to take a look at. But everybody also has the way that their story is showing up in the world today in this moment through how we're showing up with each other, or how the client shows up in the room, how the past has impacted them that's changing what they're perceiving in the world around them. So I get tripped up over this because there's so many particulars I could go into that I'm not sure what to say all at first, but that's basically kind of a brush overview of somatic psychology and how it works.
Wow. Well, for a condensed version, that was a very, very great description. And just to speak a little bit from my own personal experience, I've met with therapists since I was an early teen, and I had never, well, first of all, I had never understood until I began working in treatment that there were various different clinical modalities that, each kind of is useful in its own regard and for different types of diagnoses or treatment or whatever it may be. Is there a certain type of person or a certain diagnoses that somatic psychology kind of serves best, or a diagnosis that it's most effective in treating, in your opinion? I know you've mentioned trauma a lot.
That's kind of where I was going to start, was with trauma, because a lot of the current approaches to dealing with, different kinds of somatic therapy really focus on trauma and healing trauma. And that's because more so than, I personally think a lot of different kinds of issues, but I'll focus on trauma for right now, is impacting a person on a level that is deeper than the story that we have about what happened, right? Trauma isn't showing up because we're necessarily thinking a certain way about a situation. Something happens and our bodies, our whole nervous system is back in it. So you can talk about that all you want. You can deal with the story somebody has about what happened to them and talk about it for years. But until you change how the activation of their system is responding to those old cues, you've just found 100 different ways to talk about this horrible thing that happened. Sometimes that can even be worse in some ways.
I would think it could be detrimental.
Yeah.
It's kind of picking that scab, reopening the memories and making them, kind of putting them back in the forefront of the mind.
Right, without changing the way that they're living in the person in that moment. And so somatic psychology in its different forms not only helps to, it doesn't just activate that past impact in the body, and nervous system and mind and brain. It activates it so that it can help that activation find whatever movement, whatever awareness, whatever it needs to be able to shift and change. So, you can't talk someone out of being scared.
Right.
An example that I give a lot with people working with their trauma from like a somatic perspective is that it's kind of like if you have a kid who's afraid of ghosts in the closet. You can sit there with them and tell them for hours that there's no ghosts in the closet.
Right.
But without having the experience of something different, they're not really going to believe it. You actually have to take them to the closet, open it up, shine a flashlight around, and they're feeling scared. They think there's a ghost there. And then you're showing them in that experiential moment that, it's safe, it's okay, that they can trust it. So it's kind of like that with trauma in our bodies, is that when you utilize the somatic methods of dealing with trauma, it is helping bring that past that's in the moment to an awareness of what's actually there. And it's interesting that somatic psychology, in some ways, is very slow and spacious, and in some ways is very fast. I say slow and spacious because getting a new awareness takes the right kind of time and space. So a lot of times when you're working somatically with somebody, whereas a normal talk therapy hour might be very full of dialogue, working somatically, there's often big pauses where you're encouraging someone to feel what's going on inside of themselves and to bring that awareness up in the present moment to help to connect it to what might actually be present in that moment. I think we might talk in a little bit about implicit memory and how that can be reconsolidated and changed under the right conditions. And somatic therapy is really good at doing that kind of thing, whereas, traditional talk therapies may fall a little bit short in some ways in that regard. So yeah, trauma, to answer your question, that's one of the big ones that somatic therapy works with, and shifting those, traumatically encoded implicit memories. But also things like anxiety, things like depression. You can look at how the person's system is carrying those things and help to shift it through various methods.
What does a typical session look like? Does it begin with some discussion? Throughout the discussion, you're kind of monitoring their physiology and then getting them to check in with certain parts of their body where you might notice them holding tensions or anxieties or emotions? Or is it more kind of you're guiding them in a sense to check in and notify you where they feel those energies are being held?
Like I said, there's a lot of different ways of working somatically with people. So I'll just talk about the one that I most commonly do in the populations that I normally work with. Some forms of somatic therapy even involve physical movement or even contact between the therapist and the client, which is all within very structured boundaries to be healthy and helpful. But the kind of somatic therapy I usually do with the clients that I work with normally is a lot in helping them to notice things within themselves that they're not necessarily noticing. So I might notice a change in someone's posture, or I might notice how someone's body is responding to whatever the material is that they're talking about. So usually we'll begin by talking a little bit about a topic. It might be something that a person wants to talk about, a trauma that happened years ago, or it might be that they have something going on current that's having a bigger impact on them than they're kind of thinking that makes conscious sense. They're like, why is this thing getting so much under my skin? And to facilitate awareness in either of those cases, usually I'll help them identify where in their body they're aware of something happening around that experience. And depending on the person's level of literacy with their felt sense and body states, that might be more or less of a structured intervention. Sometimes it's as much as saying, I can tell that as you're talking about that, I see it's almost like you close in a little bit. Where are you feeling that in your body right now as you're talking about what's going on with this family member? And they might say, well, I really feel it. A lot of times it's kind of through the core of somebody's body that they feel most of the emotional stuff. It can be anywhere. But they'll say, yeah, I just feel like, my heart kind of closes in when I talk about that. Or, there's something going on in my stomach. We're all many people are familiar with some of the somatic markers of emotional experience, like butterflies in the stomach, or a pit in the stomach, or tightness in the heart area, and any other various ones like that. But usually we just brush those off and we say, oh yeah, I got butterflies in my stomach going into this thing. We just deal with it. Or, what, it'll be easier if I don't feel that. So let me just go ahead and have a Xanax, and then I won't have to deal with those butterflies in my stomach.
Sure.
But in somatic psychology, we slow things down and really pay attention and say, okay, part of your body is holding this experience of something. And we come in with that trust that that's informed by some past experience that person's had, or series of past experiences. So instead of just brushing it off or trying to get away from it, or just saying, I don't want to feel that at all, we say, no, let's bring some attention there. Let's feel what it is that you're feeling, and see, as you pay attention to that, what kind of things come up around it. And what happens is, with enough space and attention and attunement, because a lot of it is, being really present with that person in the room as another human being, they start to feel safe to sit with that body experience, and they start to become aware of the expectations that go along with it, or memories that might be connected. Things come up that tell more of the story than just, oh, I just have butterflies in my stomach. And what happens is that, I've used this term before, but the implicit memory starts to kind of bubble up into awareness. So you can actually see what it is that's coming up and impacting their experience at the present moment. And when you see what it is that's coming up, it's usually those ways that somebody learned how to survive and stay safe in the past. But when you can bring that up and we can see it in the present, you can help either guide that experience to understand what it needs in this moment to be able to be negotiated differently, Or a lot of the time, just by being with it long enough and becoming aware enough of where it comes from, you can then kind of match it more with their actual present moment experience, which causes or can cause in the right environment the shift and the reorganization and change in that.
Do you notice certain people or certain demographics that may have difficulty kind of checking in with their bodies?
There's absolutely differences in people's personal comfort with being able to identify, what's going on somatically, what's going on in their bodies. And it's interesting because I think that it is ultimately a fairly natural thing to have an awareness of what's going on in our bodies. Psychologists refer to it as the capacity for interoception, the ability to feel and see inside. And every human being, before we ever have the words to talk about what's going on, experiences things in our body. We laugh, we cry, we need things. It's all nonverbal. But as we go on, sometimes people don't have the support around attending to their internal experience. Some people are taught, an extreme example, when somebody's crying, either they're completely ignored or they receive some sort of like abuse around that. Or for whatever reason, their family culture doesn't really pay attention too much to internal experiences. It's more about what you do, et cetera. There's a number of different ways that cutoff between different parts of ourselves, and especially the internal experience, can develop. So there's some people who just, for whatever reason, their early life circumstances didn't have space for communicating or even really feeling those aspects of their experience. And so, people get very much into thought in their heads, into even sort of like an idealized version of what being a human looks like. That's away from like the experience. So actually, oddly enough, a lot of people who are very like intellectual, like engineering type folks, like I started out, it's about the thought process. It's about logic and rationality, and anything that's irrational, which, the body has its own logic. It's not necessarily that A plus B equals C that's neat and clean and that very intellectually oriented people. Because I don't really want to say that. It's not intellectually oriented people. It is people who split that very logical, rational way of looking at the world from more of that like messy, unknown version. Yeah, and it's weird talking about it too, because sometimes those people who are very logical and rational also have very wildly uncontrolled emotional expressions. It's because there's not that regulatory piece of it. It's like emotions are something that gets packed away until they explode.
I was like that throughout the entirety of my teenage years. More than a few holes punched in the walls as a kid, just because I didn't have that outlet for a healthy expression or the knowledge of how to express those feelings in a healthy way.
That's really making me think that a lot of that is developed through relationship. Emotional regulation, primarily for younger people, is done relationally. First, caregivers help develop the capacity for it, and then it becomes internalized. But without the right relational environment, it's really difficult to develop the ability to regulate ourselves. So, to me, therapy, and especially somatic therapy, is sort of filling in some of those gaps and helping people learn to contact, bring into the room, and regulate those messier parts of non-rational, non-logical experience.
Say you're working with somebody that has developed some of these skill sets to be able to check in with their body, notice the energies and things of that nature. Would you be quicker to dive into the more heavier traumas or the big T's with them versus somebody that's not yet really developed the skill set to be able to check in with their physiology, with their body, where the energies are being held? Would that be more like a gradual dive into treating their traumatic experiences versus somebody that does have more of a developed mind-body connection?
Working somatically, of course, the therapist is there to help guide the process and orient it and make the space for whatever needs to happen for that person to heal. But each body each person has their own sort of timing. And one of the things that's interesting about somatic psychology is that just about every form of somatic psychology trusts the body's ability to regulate itself and return to homeostasis given the right environment. And so somatic psychologies tend to follow the process as much or more as they do lead it. So we are creating a certain kind of a space for a person to go into these deeper parts of themselves and to bring them out and to let them express and let the awareness develop around them, let whatever needs to happen for that activation to be able to complete or move through or go toward healing. And just give enough guidance to help keep the person, somewhat connected relationally as that process has happened, somewhat connected to themselves so they're not going too far off into a dissociative process. Like I say, not too far off. Sometimes there's a little bit of back and forth. But yeah, it's really hard to know what the timing is. Some people who haven't had too much of a vocabulary around what they're feeling in their body, as soon as they get that, it's like super fast. It just kind of happens. Some people who have a good awareness of their body, they have a very particular awareness of their body. And so things go actually slower. Somebody tends to focus more on the pain and they have certain areas that their attention kind of clings to. They're over-focused on certain experiences of their body and they don't let the attention go to other places that, for whatever reason are outside of the focus. And sometimes it's actually easier to work with somebody who starts without very much body awareness than somebody who might have over-focused in particular and very rigid ways.
Wow, that's interesting.
There's this theory psychologically that health is the ability to respond flexibly and appropriately to whatever the demands of the environment are. Not to just go with the environment, but to respond appropriately. And one of the things that gets in the way of that is any kind of rigidity. So usually in working therapeutically, especially somatically, what we're addressing are patterns that are held rigidly that get in the way of interacting with whatever the real moment that a person is in a satisfying way. So, the metaphor of being stuck or languaging around it, like I feel stuck, I can't do what I need to do here. Some people get stuck in certain ways of relating to their bodies, and then it takes a lot to shift that if there's a lot of energy that goes into it. Whereas somebody who comes in as a blank slate, I don't have really much of a connection to my body, but I'm curious about it. Sometimes those people, it goes really quick. Yeah. So it more as a function of, a person's ability to remain in the unknown and remain curious and that more than it is about, necessarily their comfort level or their body awareness to begin with. So yeah, kind of interesting that way.
It is. Thank you for that explanation. And kind of on a tangent, but also on the topic of the feelings in the body and the somatic responses that people will elicit. I can't cite any references, but I've heard some stories about the neuroscience behind somatic psychologies. For instance, I heard a story about somebody that had a heart transplant, and then they would then have these really vivid dreams that they had never had before, and it had turned out that these dreams mirrored an exact experience that the organ donor had gone through in real life. Now, again, I don't know if that's just a story. I don't have anything to cite in regards to that, but could you speak a little bit on that, whether you believe there's some truth to that?
Yeah. So that's actually a really interesting story about the heart transplant, and I haven't heard that, but I'll have to look it up and see what I can find out about that. But somatic psychology, is really fairly neuroscience. It's fairly well integrated with some neuroscience. I mentioned that interoception word earlier, and I've mentioned implicit memories and things like that. So the explanation that I'm about to give is going to incorporate some of those different things. So, and today, since we've talked about trauma so much, I'm really going to focus on how trauma impacts the system of our bodies and our nervous systems. So we have this area in our brain that is in the midbrain, the amygdala, it's called, that's in charge of letting our systems know whether or not we're in danger, basically. it does a bunch of other things. But one of the things it does is it is sort of a monitoring system that activates survival skills when needed.
Mm-hmm.
And that part of our brain is actually one of the first places that sensory information goes to. One of the first places that hearing is going to, visual information is going to, sensory information, and also that interoceptive, that sense of what's going on in our bodies. So a sense of tension in different muscles, position of our bodies, but especially for this explanation, keep in mind that it's monitoring the activation of different muscle groups in our body too. So when something that's either, a big T trauma, when some big event happens that is really, I'll call it survival relevant, occurs, our organism does its best to respond to that. And that's things like activating fight or flight, social engagement, maybe first before fight or flight, and then freeze if fight or flight doesn't work, and then everything that's involved with that. But what happens in our bodies is that that's not just the idea of fight or flight or the idea of freeze. That's actually a real embodied equivalent that happens. When we get ready to run, those neurochemicals, the hormones and everything floods into our systems and gets ready. The muscles tense if we're about to fight, or our legs get ready if we're about to run. And then if we get past that point and we go past fight or flight into the freeze place, say we can't get away, we can't fight, whether it's through physical restraint or because the situation doesn't allow it. Basically, that activation stays in the body, but it's like the brake and the gas are on at the same time at that point. You have the gas from that readiness to fight, but then you have the brake of hold it back. This is going to be worse if I try to do that. So you end up with this real tension inside the body and a lot of nervous system activation that just kind of gets stuck there. And one of the theories around trauma is that whatever our protective patterns were that got activated in trying to deal with those situations were never allowed to complete. So to speak, the energy, the activation of our nervous systems that happened never got to discharge. And so our bodies maintain a state of either hyper, which is too much hypertonicity, or hypotonicity, hyper being too much, overly tense in the muscles, or hypo, certain muscle groups basically are in a given up, a frozen, really deep frozen kind of position. And when that happens, and when we maintain those, traumatic patterns in our body, remember I said that there's that part in your midbrain, the amygdala, that's monitoring your situation. And it's looking at what you're seeing, it's looking at what you're hearing, but it's also looking at how your body is in that moment. So it's constantly getting that message of this muscle is tight, we're ready to fight. Or it's constantly getting this message of I'm given up from these muscles that are in that hypotonic place. And because it's constantly getting those messages, it's assuming those are appropriate to the situation. So the way that implicit memory works is that system in our brains, in the midbrain, as it monitors our situation, is looking for convergence between the present moment situation and these models, these schema we have that were formed in the past, either through big traumas, like I just talked about, or the same kind of process can happen through repeated relational trauma. And if enough pieces match, it puts us back there. So if enough information from what we're seeing, hearing, feeling, and noticing in our bodies matches with what the old situation is, we respond as if we're back in that old situation. That's what trauma is people responding to a present moment situation as if it was just a reflection of the past. It's like I was back there again, kind of a thing. And because of that, that's the problem of trauma, is because then it's your response to the present moment is inappropriate. It doesn't match with what's actually going on.
Makes perfect sense.
So if a lot of that is that unprocessed body energy, those muscular patterns of, hypertonicity or hypotonicity, those are like check marks, so that it becomes you only maybe need to see one thing in the outside world. It might not even need to be very well matched, but since you have all that information inside, you're always in that state of being very close to a match with that old situation. And so when we deal with that within somatic forms of therapy, it is, bringing awareness to and helping to, over time, shift those internal patterns, even the muscular patterns that are informing our perception of what's going on in the world. One other thing that I want to say about that is that those implicit memories, and I've mentioned that a bunch of times.
Would you mind defining that?
Yeah.
Please?
Implicit memory contrasts with explicit memory.
Okay.
So they're basically two different ways of remembering things that we have in our brain.
Mm-hmm.
Explicit memory deals mostly with facts and things that when you remember them, you have the sensation of remembering something. So everything from autobiographical information.
Mm-hmm.
This morning for breakfast, I had oatmeal and a cup of tea, to 2 + 2 = 4.
Okay.
Those are explicit memories.
Mm-hmm.
If I asked you what the capital of Nebraska was, the memory of what that is, I think it's Lincoln. I'm not sure.
I can't
I probably got. I'm a psychologist, not a geography teacher. But yeah, those kind of things are explicit memory.
Okay.
Implicit memory is the system in our minds that represents things that are really important to be able to do quickly. So things that we've repeated enough times that we can just do them without thinking, as well as things that are really, like I said, important to do quickly, more quickly than we would have to think something through. So for example, riding a bike is a muscular implicit memory.
Mm-hmm.
We just know how to do it without having to think through every step. Tying your shoelaces, writing your name, doing your signature, that's implicit memory. How I'm interacting with you in this moment also is implicit memory. This is being informed, well, not completely, but my experience of being here with you, doing this podcast, sitting in front of these microphones, is informed by everything that I've done in the past that my brain sees as related to this moment. All of my interactions with you, all of my interactions of presenting things to people, those are all informing how I'm showing up here. And they're doing that in a way that I don't have to think about it. I'm just here having this interaction. When you are also dealing with a situation that, you've been through some trauma, and then you see something that reminds you of that trauma, and then all of those responses come up. That fast heartbeat, that part of you that wants to run, even the memories and things, that is all more implicitly coded. The really great thing about that part of our brain is that, or I'll just say that part of our mind, it has correspondence in the brain, is that without it, we would not be able to function. If you had to think about when, say, a lion was charging at you, if you had to consider, okay, well, a lion's charging at me. Well, I know that that's dangerous. Let me talk myself through how I'm going to run away from it. I'm going to move my right foot, and then I'm going to move my left foot. And oh no, he's
Right. By the time you've made the decision, you're already being eaten.
So the things that are most important for our survival, or that our brains think are most important for the survival and integrity of our organism, including because we human beings are social relationally, that's all implicit. That's all just happening without us having to think about it. So yeah, the implicit memory system is just the system in our minds and brains that organizes basically our current experience of the world based on all of our past experiences in a way that's very quick and generally seamless.
So the somatic psychologies it kind of creates a bridge to bring conscious awareness to these unconscious behaviors or responses to certain situations.
Yeah. In a lot of ways, it either creates that bridge or else it helps expose. So implicit memory is coded based on experiences. So old experiences code, our current implicit memories, including those that are sort of maladaptive or that don't really work very well. But it's really great that implicit memories are also subject to change. And the change process for implicit memories is something that's referred to as reconsolidation. So it's basically what helps reorganize a past memory that's not a linear verbal story about memory, but actually that memory as it just emerges in the moment. And one of the things that helps with reconsolidation is new experiences. Now, it's tricky because implicit memory not only organizes our response, but it's actually becomes a filter through which we see the world. So there's a challenge of, once I see a man as dangerous, I'm always going to have a sense of danger when I'm sitting across from a man.
Mm.
So you really have to slow things down and bring a lot of awareness. How reconsolidation works is if you can activate an implicit memory in the right kind of relational environment where somebody's feeling safe, where they have a good attunement from their therapist, you can activate that old implicit memory and then help them match it with a new experience, which can happen in a therapy room, which can happen between that person and themselves, that contradicts and is completely kind of trustworthy.
Mm-hmm.
If you can let them have an authentically new experience in that moment, whether it's through an embodied expression or through a different kind of awareness of what's going on, then that implicit memory can start to shift and they actually can start to let go of the activation in the body and help to actually experience things differently. So in a lot of ways, one of the goals of somatic therapy is to help shift a person's orientation to what's going on in a way that's underneath just shifting the story about it.
That's fascinating. And I've heard of other modalities like neurolinguistic programming that use similar, I guess, techniques, or based on the description that you just gave, certain experiences are tied to what they call an anchor.
Mm-hmm.
And that anchor, I guess a synonym for it would be a trigger. So that trigger creates this response in the body,
Mm-hmm.
and they're able to kind of create a new experience for the person, anchor that, and then by activating both at the same time, they're able to kind of collapse that implicit emotional or physical response
Mm-hmm.
to specific events. So it sounds really powerful.
Yeah, that sounds like a very, very similar process.
Mm-hmm.
It's really the trick of getting through an old filter that's helping a person perceive a situation in a particular and maladaptive way to opening up the awareness to more accurately perceive what's going on to match them. And then the old one that they can then see experientially in that moment doesn't fit starts to break down.
And are you able to isolate substance abuse in particular in a somatic psychology session? Meaning, substance abuse in itself creates a lot of negative emotion. There's a lot of shame. There's a lot of guilt. There's a lot of behaviors that people wouldn't typically engage in that they have as a result of their substance abuse. Maybe it's stealing or whatever it might be. So are you able to kind of address or shift a client's emotions about a particular drug? Like if somebody were to mention, cocaine, and like all of a sudden they're getting kind of excited and they're kind of triggered for it. Are you able to change that association? So when they think of cocaine, they're thinking, oh, gross, or my nose hurts, or, to where there's a negative connotation.
There are some interesting kinds of, modalities of somatic therapy that do that. There's one, Brainspotting, that does that kind of process that helps directly shift a person's orientation to their substance of choice.
Mm.
That's specifically this method that's called the model that's called the Crocodile Mob Model that Robbie Abels, I think, was the woman that kind of developed that.
Mm-hmm.
But basically helps to connect the part of the brain that has the cravings and everything like that in it with the part that has the negative consequences. Because her theory is that, the brain tends to flip between one or the other. They're not connected. It's like a seesaw. When one's up, the other's down.
Got it.
So with that method, you can actually help to, help the brain to create a linkage between, the cravings and the consequences, so that it kind of ruins the cravings part of it in some ways, what people have said in the past, that I and other folks who have done some brain spotting with people.
That's amazing.
Yeah.
Could you give a brief description of brain spotting? And everybody that I have asked for a description of brain spotting, even some of the co-founders of the modality, have difficulty describing it. But
yeah, so brain spotting, like a lot of somatic therapies, has a really high level of trust that if awareness is brought to how our bodies are holding things, those things can shift. So the way that brain spotting works with that is that they have found through that modality that different eye positions correspond to heightened activation of whatever the emotional issue or trauma or whatever it is the person's working on, that there will be some eye positions where they don't really feel very much of it, which is interesting, that you could just look in a certain place and then not feel as much of the distress, and other ones that bring up more of that connection. So generally in brain spotting, what you're doing is you're helping a person to access where in their body they're holding that emotion or that trauma or that issue through those eye position access points. And basically what happens is that you help a person bring their eyes to that spot that brings up the maximum activation for that topic. There's a lot more nuance to it, but I'll give the very simple version. And then you as a therapist are very much in tune with them, noticing how their bodies are responding, what's going on emotionally. You're present there relationally. And because that issue is being held within that relational presence, both externally and internally, that person is focusing there without really very much intention. Brain spotting trusts what they refer to as the subcortical regions of the brain. I talked about the midbrain, the amygdala, all of those, to organize and process whatever that activation is through its own resources to bring it to resolution. And so it's really interesting. They have this huge level of trust that says, okay, all we have to do is put a person in touch with how their body's holding this issue and hold it with them through this eye position. And their system will know what to do as long as we stay present with it to basically neutralize that, to help bring it to resolution. And what happens is that as you're sitting with a person, as their eyes are in that spot, as the emotion is up, it'll raise a little bit, because as they're tuning into it, it brings up more of it. Memories will come up, thoughts will come up, images, other feelings, emotions, they'll cry, their body might move even, stuff will happen. And the more you can give permission for whatever wants to happen, just let it happen. Basically, they get over that hump and the activation starts to come down. And it'll get to a certain point and they'll have a rest. They'll get to a rest point with it. And it'll be lower usually than when they were before. Then it'll come up again and then it'll come back down, maybe even a little bit lower. And over time, as you sit with that person and just maintain that really special kind of container and just basically follow where that process wants to go. Brain spotting calls it staying in the tail of the comet. So that person is the comet and you just stay behind them and support whatever wants to happen. And keep the container to a good extent that they're not getting dysregulated, too far past what their system can deal with.
Makes sense.
That if you kind of help keep a little bit of those bounds and keep the relational connection, they will get to the point where their own system resolves through that, through its own processes and returns to homeostasis, whatever that charge is before. So, it was amazing. I think that I had one client that every time he would see a red truck, he would basically get just flush of anger. And it was because of a past circumstance with a person in a red truck that he was associated with somehow that had done something to him.
Wow. I can imagine that being really disruptive in everyday life.
Right. There's a lot of red trucks out there.
Most definitely.
And I did one brain spotting session with him around that incident that had originally happened. And he came back the next week and said, I have seen so many of those trucks and it hasn't even gotten, a little bit of charge out of me. So
all from a single session.
I was a little bit blown away by that one.
Wow.
And I've had a few of those where people just in one session, it totally changes their relationship to something. Not always, sometimes it takes a few, but yeah, it's interesting that I said initially that somatic psychology is very slow in that when you have a session, there's a lot of spaciousness and a lot of room that's made around what a person's experiencing to feel, to let whatever needs to emerge. And I also said it was very fast because sometimes the results, the shifts that happen, because you're not just talking about the story about the issue, but dealing with it as it lives in the person, it can get some pretty fast results.
It certainly seems so. I mean, a single session to no longer have that impeding on his life,
Like I said, I was pretty blown away by that. And it's by no means, what to expect out of brain spotting.
Right.
But it does happen sometimes that you get those really quick shifts with it. Yeah.
And I also understand that with brain spotting, and I don't know if this applies to somatic psychologies as well, but in dealing with traumas in brain spotting, it's not necessary or not required to have to discuss these traumas that you may have been through, that's really important. I think, I would imagine, I'm not a therapist, but I would imagine that sometimes just talking about the, past traumas or abuse or whatever it may be that you had been through, that in itself could be really dysregulating and kind of draw clients' attention away from the present moment, and to where they're kind of living in their head. But with brain spotting, it's not necessary to have to discuss whatever it is that you may have been through. Is that correct?
Yeah. What's really great about somatic therapy is that, again, it's not dealing with the story a person has about what happened. It's dealing with how that is living within that person in the present moment
Mm-hmm.
or in relevant situations in their lives. So vastly more so than other kinds of talk therapies, you don't even really need to talk about what happened in the trauma. Some people want to, and it's good when they do, you just make room for it. But especially in, you mentioned brain spotting, and they make a point of saying, like, you don't need to talk about it. Some of the sessions can be completely silent. Somebody might come in and say, I have something I want to work on, really don't want to talk about it, but can we do brain spotting around it? And at that point you say, sure.
Mm-hmm.
Yeah, because it's really, you're just there as a therapist holding that emotional and relational container with them. And their own system is doing the healing. So you do the same thing. You say, okay, bring up whatever it is. You don't have to tell me. And find that spot that corresponds to it. Feel what you're feeling in your body, and you just help them to stay with it and move through it. And they never need to tell you what it is they're doing. So for some people who, for whatever reason, just don't want to go there, it can still work for that. And in other kinds of somatic therapy, similarly, because again, the story about what happened isn't so important as what it is that's in the body in that moment, and in their system in that moment. And if you can work on that and help that to move, it's not about rehashing what happened 20 years ago. It's about, okay, what's inside you right now, and how can we help that come to resolution? So that's one of the really great things about any kind of somatic therapy, and brain spotting particularly.
And I mean, just given that memory is so fallible, you can tell yourself or kind of recreate a story, and repeat the same story, even though it may be inaccurate and isn't necessarily exactly what happened in a certain event. But by telling this kind of different variation of that same story, we can then begin to believe that it is true. So it just seems really cool that we're kind of able to bypass the conscious mind and the stories with tools like somatic psychologies and brain spotting to like really address the issues at a core level.
Yeah.
And again, a lot of parallels with brain spotting and somatic experiencing, it seems.
Well, I think, brain spotting is definitely, I would consider it a somatic therapy, because the eye positions are meant to help a person connect with the feeling in their body.
Mm-hmm.
And, you're not even calling it an emotion. You're just calling it what are you experiencing in your body?
Mm-hmm.
So yeah, it's absolutely a somatic practice. And again, there's a bunch of different frameworks of looking at it, but they all have that sort of trust in the body's internal resources that can be brought in for healing.
So given all this information that you've provided tonight, which is just amazing, it's a lot. We've discussed quite a bit in a very short amount of time here. How do you incorporate your education, your work experience, your personal practices with the martial arts? How do you incorporate that into your everyday life? Have you found it to be beneficial for you learning these skill sets that you use in your profession to help other people? But has it been something that has been able to really impact your personal life as well?
Absolutely. Yeah, I mentioned my Wu Chi Fa practice, a standing meditation process, which I still do that practice today. My intention is always to do about an hour of that at night, usually before I go to sleep. And it's just time to really connect deeply and see what all is going on within my organism, within my system. And it's amazing. I always find things that I hadn't been aware of throughout the day. There's so much more to ourselves than we are able to consciously track. So it's good to have those practices to get in touch with it.
No, most definitely. And you always seem so centered, present, happy, joyful. It's really an honor working with you. And I guess just we're running short on time, so maybe just one last question. For anybody that's watching this that might be interested in learning more about somatic psychologies or brain spotting or, somebody that may not have the resources to go see somebody in private practice or go to a treatment center, are there any resources that you might suggest where they can begin exploring some of these psychologies?
Yeah, and actually, there's a lot of great books and websites and things like that. The best thing to do with that is I can put together a good list of links and things, and we can put it in the description of the podcast so people can just go
Oh,
straight
that'd be
to them.
amazing.
Yeah.
Yeah, it sounds great. Well, thank you so much. It's been really great learning from you and just hanging out with you.
Thanks for inviting me to do it, Bobby.
You
It's
got
an honor to work with you too.
All right. Have a good night, everybody.